A very good morning, all of you. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. Please vaccinate yourself and do wear mask when at public places. OAB or an overactive bladder is a frequent and sudden urge to urinate that may be difficult to control. The condition is quite common and distressing and may have a large impact on the quality of life. Let's unite to raise awareness about incontinence related issues and its impact on the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of OAB, today we have with us renowned Dr. Shakul Prakash. Dr. Shakul Prakash is Senior Consultant Urologist from Meerut. Dr. Prakash is having rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Shakul Prakash. It's a pleasure to have you
Hi,
with us.
good morning.
Good morning. So to start with, Dr. Prakash, as we are going to talk about OAB, an overactive bladder, first of all, we would like to know what is an OAB?
Actually, overactive bladder is a kind of bladder in which the patient continuously feels the urge to pass urine. Means we feel urge to pass urine when we have a sufficient amount of urine in our bladder. But these overactive bladder, irrespective of the residual urine in the bladder, patient has a continuous urge to pass urine. So it's become very troublesome for the patient and it becomes very socially also it is very embarrassing that patients have to go to every 5 minutes, every 10 minutes they have to go. So patients usually have a very high frequency and urgency to pass the urine in the daytime as well as in the night also.
Okay, so frequency, urgency, these are the symptoms we can say. Are there any other major symptoms of OAB?
Not mainly, but in the night patient can have nocturia also. Some patients will have sense of incomplete voiding also. So these symptoms are usually only this much only.
Okay. And doctor, what are the causes responsible for an overactive bladder?
Yeah. Causes are varied. There are multiple causes and they depend on the age of the patient. So usually the common cause of OAB is UTI, urinary tract infection. Other causes can be stones, maybe stones in the lower ureter or stones in the urinary bladder. Some patients of malignancy of carcinoma bladder can also have these symptoms. They mimic the symptoms of OAB. So if a patient has OAB, then investigation of that OAB, whether it is true OAB, or it is due to some malignancy or some stone or some UTI, the full investigation of the patient is needed to rule out all the causes.
So some underlying condition can also be there. So
yeah,
it's
underlying tumors, underlying
not to
stones
ignore
can
these
cause.
symptoms.
Not to ignore.
Okay. Now, doctor, whatever symptoms you just mentioned, frequency, urgency, nocturia. Now, the thing is that these are quite common in people, especially after a certain age. Now, in men after a certain age, they also have the same symptoms due to prostate enlargement issues, because again, that's common. You also mentioned UTI. UTI is quite common in women, so they do have these symptoms. And diabetic patients also have these symptoms. Now, my question is that people generally are not aware of this term. They feel that as they are aging, or as men, they are aging, or they are diabetic, so they are bound to have it. What's your take on that?
Yeah, it is very important to differentiate the symptoms of prostate from OAB because they are almost completely different. If we talk of prostate or benign prostatic hyperplasia, which is very much common after the age of 55 or 60, so the symptoms of prostate are more of obstructive, means the patient will have poor stream, patient will have to strain, patient would want to go to the urine, but he'll take some 25 minutes or maybe 30 minutes, that hesitancy will be there. Poor stream will be there, that sense of incomplete voiding would be there, which is totally different from OAB. Though overlapping symptoms can be there of OAB as well as prostate, but usually the symptoms of prostate are poor stream, straining, sense of incomplete voiding, hesitancy. so we can differentiate. If we talk of women, women usually have more chances of UTI than men. So the women usually present with UTI and they can have these symptoms, frequency, urgency, and all these symptoms. But point is this, that investigation of urine routine or UTI to rule out UTI has to be done, and then only we can label whether if she's having a recurrent UTI also, then whatever what is the cause of this recurrent UTI or what is the cause of this OAB. So investigation and proper diagnosis has to be made after consultation by a urologist.
The
As
bottom
far
line
as
is,
as
yes.
far as diabetics are concerned, diabetics patient, it's a very good question how to differentiate between them. Point is that if diabetic patients are having uncontrolled diabetes and they are having recurrent UTI because of that, so if their diabetes is under control and they are not having UTI also, then they should think of OAB.
Right. So in any which ways, the bottom line is that in case you have these symptoms, you should first go and check with your urologist so that you know you are able to diagnose the cause, and then the treatment can start. Now, we would like to also discuss about the treatment options available for an OAB.
Yeah, actually, treatment options basically depend on the cause only. If there is no causes found, it's purely an OAB. Then first is dietary and lifestyle changes, that we ask the patient to decrease the fluid intake, which is very contrary to the management of UTI.
Right.
Okay, so we ask the patient to decrease the fluid intake, and we also ask the patient to decrease the diets or which contain more of fluids. Like if we talk of cucumber, and we talk of vegetables which are made in a curry. So we ask the patient to take a plain diet which is not made of much fluids. And we can start some medications also. There are some medications which can decrease this overactive activity of the bladder, some anticholinergic, sulfonylurea, and alpha agonists. So depending on the patient's symptoms, we decide the dosages of those medications.
Right. So lifestyle modifications plus medication is the treatment, and there is a possibility that the patient will get treated with the lifestyle modification only. I mean,
can be done. Can be done. Yeah, this is a possibility.
Now, doctor, are there any food or beverages that irritate our bladders? Because people who smoke a lot, people who consume a lot of alcohol, people who consume a lot of coffee or aerated drinks, they often complain of this very thing, that they have this urgency and frequency. So are there things that actually irritate our bladder?
Yeah, actually, they don't irritate the bladder, but point is, if we take more of beverages, like if we take off cold drinks, so there is always a hypertonic solute load associated with it. So if we take beverages or we take sugar containing drinks, so there's a tendency of the body to form more urine. So because of this more urine, they have more symptoms. So basically, they don't irritate the bladder, but taking more of the beverages, patient symptoms usually increase.
Okay, fair enough. Doctor, we would also like to understand, you have already told us that what are the treatment options available. Now, if a person is, seeing these symptoms, what he or she should do to, get relief?
If a patient is having these symptoms of OAB, firstly, I would not tell or ask the patient to take some treatment himself. So he should consult a urologist. If urologist is not in the reach or not available, he should get a urine report done and an ultrasound basic done of ultrasound of KUB region, kidney, ureter, and bladder. So the most important thing, which will be any major thing which is hiding behind the symptoms of OAB, will be ruled out. And then dietary modification he can start. And these medications, it's better to start after consultation with urologist only, because they have side effects also, anticholinergic medications. And these alpha blockers, mirabagram, they are also not very safe for heart. So depending on the symptoms only, it's better to start after consultation.
I completely agree with you on that. Doctor, we would also like to understand that, many times what happens that people generally keep on suffering in silence. They don't come up with this kind of issues, and they will, it will take a lot of time for them to reach to the doctor. So now my question is, if we keep on ignoring these symptoms and not consult to any doctor, how bad or what potential complications can it bring with us?
Yeah, if the patient is not consulting the doctor, overactive bladder means the bladder is contracting a lot. the bladder contractions are high. So what happens with time is that the bladder gets reduced in capacity, and this overactivity and this pressure, this goes back into the kidneys also. So it's a very harmful thing that if the patient's bladder is contracting continuously at very high pressures, so instead of getting the passage of urine from the normal tract, instead of that, that urine gets backflow into the kidneys occurs. Because of this backflow, there have been instances that the damage to the kidney has occurred, and there's swelling in the kidney, which is we call hydronephrosis. All these changes can develop. There have been anecdotal cases in the history that renal failure has also occurred after this overactive bladder. So patient should not ignore these symptoms. So and secondly, if patient is, so there have been cases when the patient is having a malignancy and he's having frequency urgency, he's not consulting, or he is taking treatment of OAB by himself. And within 4 to 6 months span of time, that malignancy has spread to the other parts of the body also. Right. So it looks to be simple, but the complications can really be very threatening.
Yeah. So one thing is clear that OAB do hampers the quality of life, but then, it's very important to consult a doctor, diagnose the cause, and then start the treatment, because otherwise you'll end up damaging your organs like kidney, as the doctor just explained, or other complications will after you. So please don't ignore the symptoms. Now, when I say ignore the symptoms, we know that, of course, if we have urgency, frequency, nocturia, that of course it's going to bother us. We'll go to the washrooms and number of time, even if we don't go to the doctor. Now, my question is, doctor, that many a times it happens that we don't go to the doctor. What we will do, we have this trend in India, especially, we'll go to the nearby chemist, and ask them to do some, suggest some medicine, or we will take suggestion from a friend or family member, etc., who has gone through the similar problem. You said it's really dangerous, but most of the people do it. So we would like to use this platform to aware our viewers on this. Please aware us how dangerous can be self-medication or over-the-counter medication.
When patients come to me that they are self-treating themselves, I always tell them we should know our enemy. You get a USG done, you know your enemy. Even if it comes out to be normal, you know that you don't have a big enemy in front of you. But if it's like a war only. So we should know our enemy. We should know what to do and how to treat.
Right. Only a doctor can actually understand, what the underlying condition is after the diagnosis, etc., and then the treatment can be advised according to that. So please, again, don't waste your time. You're going to harm yourself more than any good. So please go and consult your doctor. We always say, doctor, that prevention is better than cure. Anything that we can do, even when we don't have the symptoms, that by what we can prevent the symptoms of OAB?
I don't think we can prevent the symptoms of OAB because the etiology is very varied. Sometimes there is no etiology for it, it is idiopathic. Sometimes it is due to some bladder or spine problem. So I can say if the patient is having some spinal issues, they're having some back problems, sometimes there is nerve compression after spine fracture, all those things. So we should get the treatment at that time only, because once OAB sets in, then nothing can be done. So at the very initial, when the symptoms are starting, or if the patient is having some spine problem, it is to consult early is the only way we can prevent it. If the patient is having, patient is a known case of diabetes, then controlling that sugar into the normal limits, that it can help.
Right. Right. Doctor, when we were talking about the, lifestyle modifications, you also mentioned that it's important to keep a check on the fluid intake. Now, the thing is that it's clear that we should, limit our fluid intake, or it should be adequate, not in excess. But in our society, we have this notion in our heads that, we should drink a lot of water, and a lot of water has no limit. I mean, people often...
A lot of water also has a limit. If we ask the patient, if a patient is having UTI or he's having a stone, so we ask the patient to drink more water. So how much water is more water? Is it 10 liters? Is it 15 liters? Is it 5 liters? But 3 to 4 liters is very, very sufficient amount of water. If we ask the patient to take more water, then 3 to 4 liters is the maximum limit. And if we ask the patient to restrict it for our body to function normally, 1.5 to 2 liters is the restricted amount which one can take if is having the patient having symptoms of OAB, but not more than 4 liters of water, because what happens with if we take more water, then all the salts, all the minerals in the blood, they get diluted. So it can be harmful also drinking 7 to 8 or 10 liters of water. So
That's
only
why
thing
we
is
say that excess of everything is bad.
excess of everything is but hemodilution, all those things, the complication, hyponatremia, electrolyte imbalance, these things they start to occur.
Doctor, one more thing. I mean, the pregnant ladies especially complain that they have these symptoms. So, is it anything to do with OAB, or it's just because the pressure on the bladder is increasing?
I would like to clarify that UTI in pregnancy can be life-threatening. The infection can spread to the kidneys. Okay, so any pregnant lady in first trimester or urine routine should be done to rule out UTI. Okay, and if UTI is there, it should be treated, because if the UTI occurs later in the pregnancy, then it can be harmful to the mother and the baby also. So patient should not ignore these symptoms of UTI. So in pregnancy, it is very important not to that it is due to the pressure effect of the uterus, or she is having these symptoms. या सबके साथ होता है. Even the neighbor says कि नहीं, it happens. Ignore these symptoms. Pregnancy and UTI can be UTI in pregnancy can be very harmful. So it really needs to be checked.
Now, that was a very important information. Now, the thing is, doctor, that, okay, now we know at least that, if we are going, if our visits to the washroom is abnormal, or the number of times we are getting up during night is abnormal, then we should, go and consult a doctor, because it may be OAB or any other underlying condition. Now, my question is how to determine what's normal and what's not, because normally we don't know how many times, one should do and void themselves. So please.
Yeah. If we talk of nocturia, some patients go 2 times, some patients go 3 times, some
nocturia is during night.
Okay, yeah. Nocturia is during night, and night is calculated from the time patient is intended to sleep. Okay, so if I go to sleep at 11 a.m. and I sleep at maybe at 12, okay, so and I wake up at 7, so the time between 11 to 7, only one time is normal. Okay, if I have to get up more than one time and I have to disturb my sleep and I have to sleep again, then more than one time is abnormal. It should be investigated. Okay, and usual frequency is 4 to 5 times a day. It varies depending on the condition. We are in the daytime, we are outside, or we are inside, how much water we are taking, but 4 to 6 is normal. What happens in OAB is it's contrasting. It is very contrasting. Patient has to go 4 to 5 times in an hour. So 4 to 5 times in an hour, every 10 minutes, maybe every 15 minutes. So we can differentiate by this. 4 to 5 or 6 times in a day is normal. But if the patient is going 15 to 20 times in a day, or maybe 4 to 5 times in an hour only, then he should be investigated for OAB.
Right. So this is the now at least we know what's normal and what's not normal. And if we fall in the category of not normal, then we should go and consult a doctor. Now, doctor, when you see the patients, I'm sure initially, it's quite because a lot of social stigma is associated with the condition. Many people have this fear of not going out, not socializing, not going to any function, etc., or traveling, because they know that they'll have this frequency, urgency, etc., and where will they find a loop to avoid themselves? Now, my question is that it becomes very difficult for a person to actually come up and go and visit the doctor at the very first stage or very first occurrence, etc. Now, the thing is that if patient keeps on delaying and then visits a doctor after a long time, how difficult it becomes to treat it?
It becomes very difficult to treat if the patient presents after a long time, because the disease has also advanced. Okay, the basic pathology, which was maybe very small 6 months back, now it has also grown. So symptoms, it takes a long time for medications to resolve those symptoms. So it's better if the patient comes up early and gets treated.
Right. And as we normally say that, smoking or alcohol consumption is bad for our health, bad for so many things. Does the same go for OAB as well?
Yeah. Smoking and alcohol is because alcohol is kind of diuretic only. definitely increase. If the patient has to 1.5 liters of urine after alcohol, he has 2.5 liters from his bladder. So definitely it will increase. Yeah.
Right. So as you also mentioned that, lifestyle modification is a very important, vital part of treating OAB or preventing OAB. So can we say that actually, going for a healthy lifestyle, eating good, taking good and, adequate amount of fluids, etc., will actually make us and our bladder healthy?
Actually, it is very contrasting. To prevent UTI, usually we ask the patient to drink more water. And if the patient is having OAB, we only ask the patient to decrease the water intake. So it's all about understanding the patient's basic problem, what he is having, what the patient is having. So it depends from patient to patient. But yes, having a healthy lifestyle definitely helps, and it also prevents us from other diseases. And as we know that the etiology is not very well understood of OAB. So if the patient is maintaining a healthy lifestyle, he's having healthy foods, but definitely he'll have better control of his OAB.
Okay. And there's one more word or term associated with OAB, and that's the treatment of OAB, and that's bladder training. Would you like
Bladder
to throw
training,
some light on that?
Yeah. That is bladder training is that we know that if the patient, even if he's having urge to pass urine, but there is no urine in the bladder, patient will only go and he'll come back empty-handed. He'll not pass any urine. So we ask the patient to train the bladder that if the patient is having severe urge to pass the urine, we ask something and he gets engaged. That we tell him, okay, you count 100 to 1 backwards. So his mind will get engaged, or to do kind of things which he loves. Suppose to play a game. Okay, you are playing this game. You don't have to get up from this. You have to stick to this game for half an hour or 1 hour. Okay. Or then using yoga or all those things also, patient can calm himself. Okay, I will not go. Because what happens is OAB, the curve is like this. That at this point of time, patient is having maximum urge to pass urine. If he controls his urge to pass urine at this time, then definitely the graph will fall and he will not have this urge. So this is the bladder training. We tell the patient you have to go to pass urine only once in 2 hours. And by that time you engage your mind, you do something which calms your mind. Sometimes there are exercises also for this which relax the bladder. They are called Kegels exercise. So what we tell the patient is, we ask the patient to identify the muscles of urine and that pelvic region muscles, and we ask the patient to contract them for 5 seconds. So the patient contracts those muscles for 5 seconds. Then we ask that to relax the muscles for 10 seconds. So that relaxation is more. Because of this relaxation, patient can have that muscles get relaxed and he doesn't have the urge. So these are the parts of bladder training we usually do to treat.
Fair enough. And Dr. Ali, take-home message for our viewers as we are moving towards the conclusion part of this session?
I will say it's not about OAB. Any symptom, any urinary symptom, burning, whether it is burning micturition, whether it is dysuria, poor stream, frequency, urgency, should not be ignored. At least show to a urologist, get a USG done, and it's better, to suspect everything and to conclude nothing. So consult a urologist, get yourself done. You should, the patient gets to know that, okay, I don't have any disease. Now the patient is also, very confident enough. So better to consult early and not to wait.
Right. So better to consult early, not to wait, because otherwise, it's going to harm you only. So please go and consult your doctor in case you have these symptoms. Thank you so very much, Dr. Shakul Prakash. It was a very informative session for our viewers, I'm sure. Thank you so very much for your valuable time, sir.
Okay. You're welcome.
And we really look forward for many more such sessions in coming times. Thank you once again.
Okay.
And viewers, thank you for watching this session. For more information on how to diagnose, manage, and treat overactive bladder, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Insta. Thank you. Goodbye. Have a great day ahead. Goodbye.
Okay. Bye.